Hi, I'm Jen Olszewski. I am the chair of the ACE program, faculty member here. Been here for 20 years in both undergraduate and graduate nursing. So the ACE program is an accelerated program designed for students to receive a second degree. So they already have a bachelor's degree in any field that they want, and they take required prerequisites and come in to complete just their nursing courses and get their Bachelor of Science in Nursing in 11 months. So the structure of the program is intense. It is all of the nursing courses. We start our students off immediately in the clinical setting, which is great, but we are careful and we let them practice in the lab and rotate between lab and clinical. So it is structured that we have didactic portions of courses mixed with clinical rotations as well. So the students get the information in class and get to go practice it. Our ACE program is really competitive. We are one of the fastest or the fastest in the country. We have a lot of applicants that apply here, and our students are really sought after when they graduate, so highly competitive. So our students take 9 clinical courses. So they take multiple adult med-surg courses, pediatrics, mental health, reproductive health, which is typically labor and delivery, geriatric care as well, and population community health. Our students are directly in clinical settings, so we partner with over 200 clinical affiliates. We are in the city, we are outside of the city. Our students get a wide and diverse experience in clinical settings. So they can be in a high acuity tertiary care center, trauma center in the city, and then they can be in a more community-based hospital or site in the suburbs as well. The goal is to get a very well-rounded clinical experience so that they can make an informed decision and understand access to care and what that looks like for all different communities. We have a lot of support for our students. We definitely recognize this is rigorous and this is not the usual way to become a nurse. It is definitely one path students can take, but resources begin first and foremost, I think, with each other. The students become really tight as they go through this program. They find their study groups. They kind of find the people that they connect with. We run like recitations with our students. We run reviews with them. And then, of course, they have their advisors. But in addition to that, we kind of have something slightly special. We have what we call NCLEX, which is our Nursing Academic Center for Student Success. And this is a mini lab that is staffed with faculty Monday through Friday, 5 days a week, 8 to 5. Students can drop in. They can schedule appointments. They can come in and practice with each other. They can practice anything from a skill to medication administration, to medication math practice, or to tutoring or kind of understanding maybe other pieces that they, maybe missed in class and they want to speak with another faculty member about it. So it is an amazing resource that all of our students have access to and love. So I sometimes get asked, how are we so successful with our graduates and within the program and our NCLEX pass rate? And I always say it's the students we accept, but it's also our faculty. We have a very strong faculty. And one of the things that we really do here is we partner our faculty's area of specialty into the classroom and teaching. So our students all have actual expertise, people teaching them with expertise in the clinical rotation that they are in. So, and we have a high percentage of our faculty that still practice nursing in some element, whether that's through their research, whether that's through working in the hospital setting or an advanced practice as well. Myself included, I've been a nurse for 30 years and I've been a nurse practitioner for about 24 and I still practice as a nurse practitioner. So I think that brings such value into the classroom and into the program because we know what's going on out there, we know the direction that it needs to go, and we know what our students need to be prepared for. So I think that brings such a richness to the program and the classroom and the experience for the students. So currently our NCLEX pass rate is about 98%. We've had a couple ACE cohorts go through with 100% pass rate. That is well above the national average, but most importantly, it's consistent. So that's not a one-off type of thing. We are consistently above the average and consistently above 93, 95, 98%. And so how do we do that in 11 months? We do that, again, with the students we accept, with the faculty that we have, and it's embedded throughout our curriculum. We prepare our students to, most importantly, practice and care for patients, but they can't do that until they pass NCLEX. So we help them get to that point. We have testing. Our faculty are expert test makers, number one. Their exams are geared just like NCLEX is, which is really testing your clinical judgment. What are you going to do in this kind of situation when you have a patient? We need to know that you know what to do, and we prepare you for that. And again, we use different programs as well, testing. We use a system called ATI, which helps really mimic NCLEX and get students ready. And at the end of the program, we have one course that is really dedicated to kind of synthesizing all of the things that you've learned in those 11 months and helps you kind of break it down, and then prepares you for the NCLEX by taking mini exams. And then we have a kind of a comprehensive board exam that you take at the end. But what's most important about it is that while you're going through the program and using the system with the faculty, you're getting feedback. What are you testing well in? What do you need to do better in? And that program with the faculty help prepare the students for that. And that's how we have such high pass rates. I would say overall, our entire faculty is so dedicated. And the best way I can describe it is we really are invested in making good colleagues, because that's what we're doing. We're nurses and we are creating nurses. And so that's so important to all of us. We have faculty. I was giving an exam one time proctoring, and the faculty had made pharmacology review cards that had really great ways to remember things and mnemonics that she had laminated and she gave out at the end of the class for the next pharmacology class. To me, that's outstanding. We have a faculty member that does walk and talks. So let's step outside of the classroom. Let's have conversations while we're walking around the city and showing you kind of where's a good place to eat, where's a great place to get ice cream, and, getting your brain out of the classroom and into the community, into the fresh air is a great way to learn. So all different things like that happen all the time. So our reputation is really strong. Our students are sought after, mostly because the rigor of this program is so strong, and it's recognized in all of the community out here with our, hospital systems. I get called regularly. Can we come in? Can we pitch to your students? Can we run, a recruitment event with your students? My favorite thing is writing letters of recommendation for students to be employed, and then getting the email that they are employed. And that's from California. We have a large base of students that come from California. I have ones that just got hired at UCLA, Stanford, and one that just got hired, locally again around here. So sought after, high rigor, and a lot of graduate students as well. So the best part about the ACE program are the students, because they really do come from different backgrounds, educational backgrounds, professional backgrounds, employment backgrounds, life backgrounds. And that is what really brings the richness to the program and eventually to their nursing practice and our profession. So my favorite thing is to figure out, I will sometimes say, what did you do before this? What brought you here to this? And one of my favorite stories was I had a student that was a documentary filmmaker, and she was making a film on the opioid crisis. And that drove her to really look into nursing, because she really wanted to address that and make a change. And I love that story. It's one of my favorites. So our ACE program really has a wide variety, of students that come in here from different ages. We do have a population of students that maybe change their mind in their first degree, and they're looking toward getting their prereqs done in their senior year of their first degree. So this is kind of their 5th year of college for some of them. That is a chunk of students we have. Then we have a chunk that maybe came from other backgrounds and other areas of work, whether that was teaching or filmmaking or psychology, kinesiology, all different backgrounds that they will really come from. And some took a break from work and maybe were raising their kids. And so they decide to kind of come back, and this is something I've always wanted to do, and now I want to do it. And I'm showing my kids that you can do anything whenever you want. I've had students that have PhDs and decided that they were maybe working within the healthcare system, but during COVID, they were really inspired to get kind of more hands-on with patients. So we have a wide variety of ages and backgrounds. And again, I watch the students kind of mesh together, and that's who you're going to be working with. And that's who you're going to be caring for. So it really kind of lends itself to what the profession looks like, all different ages, all different backgrounds. The students love the space. They're upstairs right now outside of our offices, in our conference room, in our huddle rooms, using whiteboards studying for midterms today. And I love being able to walk by and be like, you okay in there? Do you need some water? Because they are so engaged and working together. So the space is why every student that comes in here that's not in a health science student or in CNHP is like, oh my gosh, this is wild. When I first walked in this lab, if you know, in our other building, it didn't look like this. When we moved here, I literally cried because I was like, I can't believe we get to teach in here and they get to learn in here. And this is so amazing. So it really lends itself to long days. You might have long days of classes, but you have an amazing space to move around in and learn. Simulation is a great tool for us to use to help students learn. We don't just use simulation to test students, right? Because sometimes that can be a little nerve-wracking. We really use simulation to teach too. So for example, in our critical care course, rather than learn rhythms, you know, EKG strips, what you see all on TV, our students will learn it in a simulation with a faculty member right there. So they will come into a scenario where maybe the patient has VTAC, something you hear on TV. And then they will have to walk through the ACLS steps, not just verbalize it, they will do it. They will shock, they will give the medications, and they will do all of that with faculty guidance, with the algorithm that's there. And so then it becomes a part of like their practice and memory. And so all of our simulations are wonderful, but I always say, and the space is gorgeous, but it's really based on the faculty and how they build the simulations so that our students can learn from them, not just practice a movement, but really embed it into their way of thinking as a nurse. I think what sets us apart from other programs for sure is our faculty. Really, again, because we do have all of the specialties covered within our faculty, and our faculty are married in those courses where they are experts, where they still practice. Someone that teaches peds, our faculty that teaches peds, they are working nurse practitioners at CHOP. They are working researchers at CHOP and nurse educators. So I think that that really brings, and that's just one example. You know, someone that teaches in adult classes, they are working at Fox Chase, they are working at St. Luke's, they are working within like the area, at HUP, at Cooper. So I think that is really what sets it apart, is our connection to current clinical practice, which is part of like Drexel in general, right? That kind of falls through with Drexel, I feel like. Drexel has, you know, brings a lot of industry into the classroom, but everybody's still within that industry.